Yeah, I mean, we're very, very lucky to work with the Innovation Agency in NHS England, and they're one of 15 academic health science networks, as you know. And I think they're both, the work they do individually is very impressive, but the role that they've played in the network is also really kind of noteworthy, and particularly Liz's role has been really important to us in kind of bringing the might of the network to bear. Yeah. I suppose this idea of kind of experimentation and learning, that there's a lot of talk about adoption of innovation as though there is an answer to that question. Kind of my view is that there are many answers, as I was saying. What works for adoption of innovation is different by product, by context, by group. And that I'm very keen that we kind of set up ways of working with people where we can learn what works in different contexts for different products, for different groups, and then kind of distill that learning to think about what we can do nationally to support it. In some ways, this is the nicest time to be involved in innovation because the need is so clear. You know, we know that funding is tight for healthcare. We know that the needs of the population are completely changing. We know that the population is becoming used to running their life in completely different ways outside of healthcare. So it feels like the perfect storm in some ways for the really transformative power of innovation to be unleashed. This is the thing that that excites me most about my job, is thinking about patients not as passive recipients of care, but you feel as though technology has completely changed the power dynamic between individuals and kind of organizations and power structures. So I'm really excited to see over the next coming decades people become much more empowered about the kind of health information they want, the kind of decisions that they feel they can participate in, the kind of interventions that they think are acceptable or not acceptable, the kind of side effects that are kind of understood more that we never really have thought about in terms of the medical literature. So I think actually this is an extraordinarily exciting time, yeah.